Hi, friends. I'm Dr. Ben Keller, and this is Introduction to Pharmacology, week one, day one, session one. I foresee this being about the first 15 minutes of an introduction to nursing pharmacology. And this is for partial fulfillment of Nursing 576 Instructional Strategies with Dr. Peg Rooney. First, a brief welcome. I really enjoy pharmacology, and I hope that by the end of our class time together, you will enjoy it as much as I do. We're going to do a little bit of patient-centered care, focusing on that. And then I'm going to really hone in on some basic terms. So the sympathetic nervous system, beta 1, beta 2, other key terms. And we're going to utilize albuterol and look at some drug names just to get some pretty important concepts introduced here on the first day of class. And then there'll be a homework and a time for review. So I want to tell you a little bit about Miley. Miley is a little 8-year-old girl, and she absolutely loves to run, loves to be outside and play. And a few weeks ago, she was having some difficulty breathing, and her mom took her to her doctor, and her doctor thought that maybe she had asthma and prescribed an albuterol inhaler, and the nurse came in and taught her how to utilize it. And a couple weeks later, she's at the bus stop after school, and she's running around and playing tag with her friends, and she loves it. And it's a spring day like today, and the trees are in full bloom, and she starts to get harder and harder for her to breathe, and she's getting tightness in her chest and shortness of breath, and she's starting to get really panicky, and she can't breathe, and her friend Lisa notices that she's in distress and comes over and says, "Miley, what's wrong?" She said, I can't breathe. And she said, "Do you have that thingy that you showed me on the bus a couple days ago?" And she said, "My inhaler." And she said, "Yes, I have that." And so she said, "Why don't you use it?" And so Miley shakes it up and she gives it a puff. And it helps relax everything. And a second puff. And things open up and the crisis is averted. And friends, that's pharmacology. It's basically the right drug at the right time for the right reason. But it's not really about the medications. It's about the people that we help with those medications. And because of that, safety is paramount. We always want to think safety when we do pharmacology. So let's play you back to some pathophysiology. What do we know about asthma? So asthma has a trigger. There are allergic or inflammatory responses. It releases the histamine, right? The histamines cause some bronchoconstriction, and the primary treatment for acute asthma exacerbation is what? It's albuterol. It's which is a short-acting beta-2 agonist, and it reverses the bronchoconstriction in the smooth muscle tissue. But how does it do that? Well, let's go back to our pathophys. So we have our beta receptors. We have beta 1, which is found primarily in the heart. Beta 2 is where found primarily in the lungs, right? You have one heart, two lungs, right? One heart, two lungs. Exactly. So let's go to some key terms, and you'll notice that this KT logo is up here. These are key terms that you need to know, and you'll see these that logo on some of the slides. I mean, you need to know that stuff because it's going to be in a test that I'll give you. So receptors, they're found on cells that are triggered by medications, hormones, electrical signals, all kinds of receptors, pain, different types of things. You remember those from pathophys and from A&P. So then you also have fight or flight, and that's what? That's the response of the sympathetic nervous system that increases the heart rate, it opens up the airway and increases blood pressure so you can fight or flee, so you can face the bear, right? Well, what's it doing? It's stimulating the beta 1 receptors, which are found mostly where? Heart, right? Beta 1, one heart, which increases your things like your heart rate and your blood pressure. What else? You got beta 2 receptors found where? Mostly in the smooth muscle tissue of the bronchi, in the lungs. When it's stimulated, it causes bronchodilation so you can breathe easier. Great, right. So then we had the term adrenergic. What does that look? Adrenaline, is it right? It looks a lot like it. It's because it has to do with your adrenal glands that are sitting right up here on top of your kidneys that pump out epinephrine. And that stimulates the sympathetic nervous system, that fight or flight, right? Then you have the parasympathetic nervous system, which is the rest and digest, right? It's the opposite of the sympathetic nervous system. And we're going to discuss that more after break. We have this term agonist, and I'm going to hit this a little bit more after break too. But agonist is a drug that causes the same action for a receptor. So it mimics it, it promotes it, increases the particular action of a receptor. And so if it's a adrenergic agonist, it's going to increase the effect of adrenaline. It's going to mimic that effect. But you can also have a parasympathetic agonist, which is going to increase the rest and digest. That's crazy. And we're going to get there. And we're going to unpack that a lot here in the next half. You have the word antagonist, and that's a drug that fits the receptor, but it blocks the action, decreases the action of a particular receptor. And so think about the antagonist in a book or a movie, right? The antagonist and the protagonist, they fight each other, right? The antagonist wants to stop the movement of the good guy. The antagonist is the bad guy, right? So here's another way of looking at it. The antagonist increases the action of a receptor. So it's like a key in a lock. So imagine this is the drug, and this is the receptor. And so the receptor, drug goes into the receptor, pops in there like albuterol, and it unlocks the trachea, right? It unlocks the bronchi, helps people breathe, right? So it does what it's supposed to do. Now imagine I've got this is now a beta blocker, and I'm going into the heart, and I try to put metoprolol in here, and what's it do? It blocks the action of this key. It won't open the lock, but I can't get epinephrine in there, right? Or adrenaline, right? So this is what a beta blocker does. It blocks or decreases the action of a receptor. And so here's a good example. I exercise and I take metoprolol. And when those days that I take metoprolol before going to the gym, I can't get my heart rate above about 135. It doesn't matter how fast I run on the treadmill. The metoprolol puts the brakes on the epinephrine. So beta agonists and beta antagonists. So for the beta cells, adrenaline or epinephrine, caffeine, albuterol, these are all beta agonists. They protagonists. They increase the effect of the sympathetic nervous system on the heart and the lungs. It opens up the heart and the lungs. It speeds up the heart. Then you have metoprolol. Think antagonist or anti-agonist. You see how that works out there? It decreases or blocks the effect of epinephrine or adrenaline on the heart. It's how a beta blocker works. It blocks the beta 1 cells in the heart. It slows down the heart rate. And you see this little ID here? That means it's an important drug, and I want you to know it. I made you a little bit of an animation here. So let's say you want to speed up your car. What are you going to do? You're going to push on the gas pedal, right? So that's like an agonist. You push on the gas pedal, a beta agonist, you're going to speed it up. Now, let's say you want to slow it down. You put on the brake pedal. That's the antagonist. It's going to slow things down, right? There you go. So let's apply this with a drug that we all know, albuterol. It's an important drug. You need to know it. So what you need to know is that it's a med class. You need to know that. It's a short-acting 2-beta agonist. It's going to promote whatever that is. It's going to promote the beta-2. The suffix is albuterol. I want you to note that. We're going to talk about that in a second. Mechanism of action, it stimulates the beta-2 receptors in the lungs, and it has a minor effect on the heart. So why is that important? Because it treats asthma, but it can also cause tachycardia. Because anything a drug does well, it can do over well. It can cause hypokalemia, but that's not important today. But why does albuterol increase the heart rate? Because it also has a little bit of action on those beta 1s in the heart. So let's look at some drug names. So here's some nice things to know. It's okay to know some trade names. But what you need to know are going to be the generic names, and you don't ever need to know the chemical names. Don't waste your time on that stuff. So why don't we just look at the trade names? Well, these are just a few other names for Tylenol, Excedrin, Pamprin, Tylenol, all these different words. Isn't it just easier to know one, like acetaminophen? So let's take a look for some clues. So the NCLEX is going to try to fool you, and there are going to be drugs on your NCLEX exam that you've never heard of, and they know it. But there are clues, and I'm going to teach you how to be successful at these. And that's, you can look at the suffix or the prefix for a number of key drug classes. There are about 30 prefixes or suffixes that you need to know. And you can learn the suffix or the prefix, the mechanism of action, its use, its adverse effects, and its key teachings or contraindications or safety issues and things. And that's stuff we will learn. An example, albuterol. What's the suffix? Terol. Class of it, it's a beta-2 agonist. What's another beta-2 agonist? Salmeterol. What do you notice? Terol. All right. What do you think about formoterol? Have you ever heard of formoterol? No. What do you think it does? Yeah, it's another beta-2 agonist that helps with the shortness of breath. All right, now let's take a look at metoprolol. Now that's a beta-1 antagonist. So it's cardioselective. It means it focuses mostly on the heart. That's important. We'll talk about that after break. Class, it's a beta blocker. Suffix, metoprolol. Think O-L-O-L. It's the suffix here. Think old lady online who's taking her heart meds, right? What's it do? It blocks the effect of adrenaline on the heart or epinephrine on the heart. It slows down the heart. Just like when I'm trying to exercise, it slows down the heart. It treats tachycardia and hypertension, but it can drop the heart rate too much. And so you don't give it if its heart rate is under 50 beats per minute or if the systolic blood pressure is less than 100. And so what do you think propranolol does? What do you see? You notice O-L-O-L, old lady online. What is it? It's like metoprolol. It's a beta blocker. Awesome, right? So let's do a quick review. I'm going to invite you to print this out, and you can go through this and find the right answers. And I want you to rewatch this video once and fill in the blanks. So it's the right what at the right what for the right. And then I'm going to then invite you to have a little bit more fun, and that's by utilizing a Kahoot quiz or homework that I gave you. This is due on April 17th, and I want to know who's the fastest one in the class this week. And the faster you get the answers in on the Kahoot and get the questions right, the higher your score. The winner will get a prize for in next week's class, but everybody's going to win because at least one of these questions are going to be in your next exam. And I do this for you every week. There are homework questions that end up in your exam. Why? Because I want you guys to know this stuff. It is important. It is what we do most of the time as nurses. We give a lot of medications, and it's super important for us to think safety and to help keep our patients safe. Here are some references for you. And thanks so much for joining us on this first taste of pharmacology. And I hope you enjoy it and love it as much as I love this subject, because I do.